Thank you very much for that kind introduction, and thank you for inviting me to talk today. So first things first, I've been asked to show you our Twitter handle and our hashtag, so please get tweeting. I'm an acting consultant in Liverpool. I work at the Royal Liverpool University Hospital, which is actually just a stone's throw from RCP North. So today we're going to be talking about the Chief Registrar programme and how it's changed over the past 3 years. So we all know that the NHS structure is extremely simple. It can be very perplexing for some, and unfortunately still there's far too much working in silos, and often it's difficult for junior doctors to have their voices heard. And the important question is, how can we nurture junior doctors who are interested in leadership whilst providing the best quality of care for patients in the modern NHS? Well, the Future Hospital report was published in 2013 with a vision to improve medical care by structuring services around the needs for patients. And one of the big outcomes of this was the concept of a chief registrar. And the idea is that a chief registrar would be a conduit between junior medical staff, junior doctors, senior decision makers and trust managers. And the aim was to try and identify and develop future clinical leaders whilst importantly improving services for patients. So to be a chief registrar, you need to be ST4 or above, but typically trainees are usually a bit more senior. Initially it was a 12 to 18 month post, but the newer chief registrars are generally undertaking 12-month posts. It can be in or out of programme, with the majority of people staying in programme, but a large minority going out of programme. And there's protected time for leadership and management, and this usually equates to 2 to 2.5 days a week, which is protected for that role. And there's also a bespoke teaching programme that's put on, that's been developed by the Royal College in conjunction with FMLM, and there are 4 modules over a 10-month period down at the Royal College. So chief registrars are senior hospital managers. They should have clout and respect and responsibility and the ability to undertake serious projects. So when I was a chief registrar, I had a 2-way speed dial relationship with my mentor, who was the deputy medical director. So she would usually get back to me within the hour, or at worst 24 hours, which is unheard of usually for a junior doctor working in any hospital trust. The role also brings lots of opportunities to present, to publish work, and also to network. So for example, today, the chief registrars are meeting during the conference at the QI Hub. You're welcome to come and chat to us. And also afterwards, we're having an alumni meeting. And, as ever, these days, people keep in contact via WhatsApp. So we have WhatsApp groups where we share examples of good practice with each other. And there's a photo there of one of my colleagues, Deshan. I'm in the background. That's 2 years ago at the RCP conference here in Manchester again. We were at a round table meeting with MP Philip Dunn. So there are lots of opportunities afforded to chief registrars. So you could classify the chief registrars into various broad themes, but the chief registrars normally wouldn't just focus on one of these. It would span across various domains. And what is covered is usually dependent on what is needed by the trust and also ideas that the chief registrar will have as well, and the areas that they would like to explore. So the educational element that is provided by the RCP really aims to try and develop the leadership skills. And I'm not going to discuss any of these, but these are just some examples of some of the things that are covered by the educational component. And one thing that I found very useful by this is that we had action learning sets. So we would group together in groups of 6 to 10 chief registrars. So this was an environment which was friendly, it was open, it was a safe environment where what we would discuss was confidential. And we could bounce ideas, problems that we had off each other, and then through a collective, reflective process, come to a decision of how we were going to tackle a particular problem. And that was very helpful, and I've actually taken some of that forward with me. So let's talk about numbers. So the initial Chief Registrar cohort that I started on, there were 9 of us, and that was expanded that year to 21. And we've seen year on year that we are having increasing numbers of Chief Registrars. And for 2019-20, I believe there are around 40 to 50 confirmed Chief Registrars, but there are over 100 expressions of interest. So it looks as if we're going to year on year increase numbers yet again. Looking slightly further into those metrics, we can see, so in the first year, this was only physicianly specialities that was open to. And then in year 2, we had an experiment. We had some orthopedic and anaesthetic trainees who became Chief Registrars also. And since then, it's been opened out to other non-physicianly specialities. And now we can see neurosurgeons, paediatricians, palliative care medicine. We've got Chief Registrars in different domains. And for 2019-20, I believe there are multiple trainees who are obstetrics and gynecologists and general surgeons who are interested. So it really does show that the Chief Registrar scheme is expandable further than just the simple medical specialities. So just to talk about a few of the example projects, so a lot of the projects focus on morale. You know, morale is a big issue at the minute, so Bod spoke about burnout. But we have had a new contract imposed on junior doctors. Junior doctors' pay has supposedly fallen. We have 7 out of 10 junior doctors working on a rota with a permanent gap. We have increasingly difficult and intense shifts that people are working. So a lot of the projects are focused on improving the working lives of junior doctors. And these are just some of the examples. So patient care. So a lot of these initiatives are very simple, but what it needs is somebody who has time that's protected, so they can sit down, they can start from beginning to finish, take one of these projects to fruition, and then maintain it. Because Chief Registrars have 2.5 days a week protected for this, they can implement these. And through our WhatsApp group and shared learning, then people replicate these models in other hospitals as well. Education and training. So my trust told me that my main remit was to improve the education and training of where I was, because we were in special measures for education and training from the deanery. And from the work that I did with my team as a Chief Registrar and subsequent Chief Registrars after me at my trust, the trust was subsequently taken out of special measures. So that's another important output. Patient flow. So we have fewer than half of the number of inpatient beds that we had in the 1970s. We've also got an increasingly comorbid and elderly population whilst nursing home beds are falling. So there's a perfect storm, and we've never before had such focus on patient flow. Well, Chief Registrars have managed to implement so many different projects that have helped patient flow. That's another very important issue. Health tech. We've got a health secretary that is really pushing health tech, and rightly so. And we've got Chief Registrars who have been experimenting in health tech and have implemented projects using it, and we'll look at some of those later. So just briefly to give a few case studies. So these are some of my colleagues who are Chief Registrars. So Debashish on the left-hand side there, who is an interventional cardiologist who becomes a consultant in 6 months' time. Then Tahir Akbar, so he's a consultant gastroenterologist who finished his training 2 months ago. And in that small amount of time, he's already been given lots of senior management responsibilities, including being an RCP college tutor and the trust lead for physician associates. And then Amar Patana, who is a consultant diabetologist who also has had lots of senior management positions, including being chair of the Young Diabetologists Forum, and he'll kill me for putting this photo in, but this is a photo of him receiving Excellence in Patient Care Awards from the RCP for being the best trainee last year. And then finally, Michelle Cooper, who's a consultant in acute medicine, who was a Chief Registrar after myself at my trust. So what Deb has done, so he has designed a new app, which is a virtual clinic platform, and it's a two-way interface. So patients can record their symptoms in a diary, they can record their heart rates, blood pressure, other observations, and clinicians can remotely access this, or they can be accessed if they come to clinic. On the other hand, clinicians can send out information to patients using the app. They can send out questionnaires. They are sending clinic letters digitally via the app after they've been seen. And also, there's a large role for telemedicine and video conferencing with this. And following an initial trial in cardiology and oncology, they have found that the DNA rate has plummeted. They've managed to see more patients. Because patients are not having to travel to hospital as much, patients are actually saving money, and patients really appreciate this system. And they're estimating that they're saving around £1,000 per clinic. Now, this is just a trial at the minute, and it's still to be expanded, but it's very exciting stuff. So Tahir really had a passion to improve the working lives of junior doctors, and you can see here a few examples of the projects that he's undertaken that really are focusing on morale. And astonishingly, what Tahir managed to do was, after 6 months of being a chief registrar, the job satisfaction rate became a lot higher, and as a result, absenteeism has plummeted. And that was maintained at his trust. It'd be very interesting to see if that's replicated elsewhere, but he did a very good job there. And additionally, his trust was also a red from the Deanery for Education and Training, and following his implementations and his projects, it went to an amber, and following a subsequent chief registrar, it then went to a green. So we can see here multiple episodes of the relationship between trusts and deaneries improving directly as a result of chief registrars. So Amar, he, being a diabetologist, looked at patients with diabetes and with dementia. So he retrospectively looked at 350 patients, looking at their case notes while they're in hospital, and identified areas where perhaps the care was slightly suboptimal. We weren't really thinking holistically as an overview. You know, this is a cohort of patients who are very frail, comorbid. Perhaps their quality of life wasn't thought about with all the medication burden they were taking. So they created a diadem framework and then prospectively looked at 150 patients, and they managed to more than half the number of medications that they took. And specifically, patients taking 2 or more medicines reduced from 8% to 2%. So they managed to reduce that burden on patients, improve quality of life, and potentially have some cost and safety implications too. And for that, he was awarded another prize, Quality and Care from the Diabetes, again. So this is the project that Michelle did, an ambulatory care clinic. So this is it's a pretty simple concept, and a lot of trusts are already running these. But our trust didn't have one. And what the framework of the chief registrar allowed us with the shared learning. So Michelle managed to look at other projects and replicate them and improve upon them. And she managed to, through facilitating early discharge and GPs referring directly to the ambulatory care unit, managed to massively improve flow through the ED, and potentially through saving hundreds of bed days, that could have a good cost saving too. So e-handover is something that I've led on recently. So we all know that handover is a very dangerous time in a patient's journey through hospital. So what I did with my team is, so we sat down, doctors, nurses, IT specialists, and we designed some software. It's web-based software, so it's scalable elsewhere in the NHS. And this documents handover between nurses to doctors, doctors to doctors, and pharmacists to doctors, and for handover of clinical information. So what we've managed to do is create an auditable trail of all handover. Handovers have become better in terms of quality. There are fewer overall handovers, saving clinicians time. And importantly, patient safety has improved. And very interestingly, the number of cardiac arrests has actually fallen. But the causality is difficult to determine because there have been other things that have happened in the trust during that time. But nevertheless, it still is a very useful and important outcome. And this has also been shortlisted for various awards, including an RCP Excellence in Patient Care Award for Best Innovation. So just to touch on cost savings a bit more, so without going into too much detail in the interest of time, another initiative that I pushed and I led on when I was Chief Registrar was to create an independent discharge team who were completely independent of the acute on-call team, so they could just focus purely on discharges, and managing to save over 800 bed days a year. And theoretically, that's a large cost saving that can bring. But even more importantly, that brings big help to patient flow and potentially to patient safety. So important to think about the cost savings there too. There was an independent evaluation undertaken by the University of Birmingham in the first year of the Chief Registrar project, and what they found was that Chief Registrars were spending around 30% of their time on leadership and managerial activities, where when we're expecting them to spend 40 to 50% of the time, considering that they're usually still on on-call rotas and the pressures that we've had in the past few years on the acute take, 30% isn't too bad a yield really. And they also found that there's likely to be cost savings associated with the Chief Registrar programme. So what's been achieved? Well, I think we could say probably more than was expected when we first set out. I'll just leave you to read a few of these quotes from people affiliated with the programme. Going forward to next year, we're looking to have more Chief Registrars again. There is now a cost element associated with the Chief Registrar programme, and this is important because in my opinion, it's still very good value for money, because what you get with the Chief Registrar programme, you get the national framework of the alumni and shared learning, as well as the educational element, which is obviously costly for the RCP to provide also. We're already seeing Chief Registrars who have completed the programme become consultants, taking up senior managerial positions, and this is likely to increase in future. Just to very briefly touch on other programmes, leadership programmes, the National Medical Directors Clinical Leadership Clinical Fellow Scheme and the Scottish Clinical Leadership Fellowship second trainees out of programme for 12 months to a national medical organisation. Chief Registrars are employed as senior leaders in their local trusts. They're still on the coalface every day seeing unwell patients, and they can stay in programme. So it's very different to those other leadership programmes. We also have flexible portfolio training, which should be very interesting when it comes in. But again, this is different. Trainees will spend 1 day a week on one of 4 domains: research, education, clinical informatics, or QI. And again, these people aren't senior managers in the hospital. So the Chief Registrar programme really is unique. So if you want to help patients on a larger scale, if you want to improve your own leadership skills, or if you're looking for a new challenge, think Chief Registrar. If you're a trust and you potentially want to try and save money, if you want to improve patient flow, if you want to improve patient safety, or improve your relationship with your deanery, think Chief Registrar. So I hope that was a nice whirlwind summary of what's happened the past 3 years. If you are interested to speak to one of us, please come and speak to me or one of the other Chief Registrars. We'll meet at the QI Hub later. And again, here are the hashtags, so please get tweeting, and the email address here for the Chief Registrars at rcplondon.ac.uk if you have any specific questions, or if you have questions on some of the initiatives I've spoken about, please feel free to contact me as well. Thank you.